Ms. Cooper. This is my video for my IM injection checkoff. I'm going to start out by reading from the drug book. For epinephrine, which is a high alert medication, the indication for my patient is anaphylaxis, which is correct and appropriate for this medicine. It is management of severe allergic reactions. The action is to inhibit the release of mediators of immediate hypersensitivity reactions, bronchodilation, maintenance of heart rate and blood pressure, and some adverse reactions and side effects I would look for: nervousness, restlessness, tremors, headache, angina, arrhythmias, hypertension, tachycardia, nausea, vomiting, hyperglycemia. They can also acquire skin and soft tissue infections. The safe dosage range is 0.3 to 0.5 milligrams. Do not exceed 0.5 milligrams in a single dose, and you can repeat every 10 to 15 minutes as needed. His dose is within those ranges. Some special considerations: I would make sure my patient is not on any other adrenergic drugs, any MAO inhibitors, any beta blockers, or tricyclic antidepressants. Those will affect the use of this medication. I would assess lung sounds, respiratory pattern, pulse, and blood pressure before administration and during the peak to make sure it's working. I would assess lung sounds for wheezing especially. Assess for hypersensitivity reactions, which could be a rash or swelling of the face, lips, or eyelids. Monitor for chest pain, arrhythmias, and a heart rate of over 110 and hypertension. I could also assess for toxicity and overdose. Those symptoms would include persistent agitation, chest pain or discomfort, decreased blood pressure, dizziness, hyperglycemia, hypokalemia, seizures, tachyarrhythmias, persistent trembling, and vomiting. If any of this were to occur, I would alert the provider. I will administer this into the middle of the outer thigh. And for most medications, you do not massage the site of injection, but specifically for this one in the book, it says to rotate the injection sites and also massage the injection site after administration to enhance absorption and decrease local vasoconstriction. Some education for my patient: instruct him to alert a healthcare professional if he experiences shortness of breath, diaphoresis, dizziness, palpitations, or chest pain. I have my MAR here. I also have my medication, alcohol pads, gloves, my patient, and my needle. I will be using a 22 gauge 1 inch, which is appropriate for an IM injection. Okay, my video cut off and I had to move you anyways. So I have my MAR here. I have all of my equipment. I've checked the medication order. He has no allergies that we know of, so that is good. He is able to get this medication. And I have performed all the necessary calculations. We have 1 milligram per milliliter, so I just divided that and he will get 0.5 milliliters. So that is correct. Now I'm performing hand hygiene, and I will put on gloves. Let's hope you don't fall this time. Okay, I'm just going to go right here. I will take my alcohol swab, or my pad, scrub the top of it for 15 seconds. And then I will let this dry before I inject the needle back in it. I am drawing up 0.5 milliliters into the needle already. This is dry now. Taking it straight off, inject air into air, flip it up, pull out the medicine slowly so that there are no air bubbles, and if there are, I will get them out. Sorry, that's really... Okay. There we go. Pull that off. Recap using the one-handed scoop method. Not contaminating my needle. That's trash. Okay, so I drew that up. And now I'm going to take these gloves off. I have to reuse these, so I'm sorry. I wouldn't normally take them off this way. And perform hand hygiene. Now I'm carrying the medication to the room so that I can scan the barcode and administer it to the patient. Okay, now I'm in the room. Mr. Isbell, can I get your full name and date of birth, please? Mr. Isbell, 02/01/1979. Okay. Do you have any allergies? No? Okay. Well, this is a shot of epinephrine. It's going to help you with your allergic reaction. Do you have any questions for me? No? Okay. I have pulled the door closed, provided privacy. I'm going to perform hand hygiene. I've done all of my assessments, assessed his lung sounds, his respirations, blood pressure, pulse, heart sounds, all of the above. Now I'm going to put my gloves on. I performed hand hygiene. Now I'll put this on. I have performed my 9 rights. I have done my 3 checks. I checked the med whenever I pulled it out to the label, to the order, to the MAR. I'm checking it in the room one more time. I looked at the wristband. This will be administered into the ventrogluteal, not ventrogluteal, the middle outer thigh. Don't know what I was thinking. I'm going to rub this for 15 seconds. Moving from inner to outer, and then I will let it dry. Okay. I'm going to let it dry. I also would be performing the Z-track method, pushing the skin with my hand, administering it, and then letting go at the same time that I pull out. Okay, this is going to be dry now. I'm going to take this off, straight off. Hold the skin tight. Administer at a 90-degree angle. Hold it. Out. Take some gauze. Put on the area, and I will massage it. This would go in the sharps container. I would not recap, but for purposes of this video, I'm going to. But I would use the one-handed scoop method, making sure that I don't get myself. I massage the area. I will assess my patient, make sure that he is okay. Are you comfortable? Do you need anything? No. I will remove my gloves. Not like this, but I had to reuse them. Wash my hands. I would document everything as soon as I get done. I will keep monitoring my patient for any adverse and side effects. And that is it. Thank you.